Well, it's October 21st, 2021, and we are closing in quickly on the termination date for unvaccinated staff at Gundersen Health System here in La Crosse, Wisconsin. I want to throw some numbers at you to show you why this is important if you are a member of this community. Let's start back over a year ago. We were having a surge of COVID patients. It was scary, it was ugly. We had over 300 patients in the hospital here in La Crosse, and a large chunk of them had COVID. Then the vaccines came out, and everyone was feeling like there might be a light at the end of the tunnel. COVID cases dropped, the weather warmed up. In the spring of this year, Gundersen's leadership finished renegotiating the contracts with some of our low wage staff, and they lowered the wages of our custodial staff, and they left in droves. We started having problems maintaining our usual high standards of cleanliness that a hospital really needs. In April, we were looking at about 600 job openings across the organization, and that was record territory. Over the summer, there started to be chatter about vaccine mandates for healthcare workers, and we were reassured by Gundersen leadership that they wouldn't be imposing any mandates. We've been told from the beginning of the pandemic that if you use your mask, goggles, social distance, practice hand hygiene, you'll be fine. COVID won't be transmitted at the hospital. In August, that changed. Gundersen not only imposed a vaccine mandate, they were right off the bat opposed to allowing any exemptions. This was in contrast to our federal institutions, the makers of the vaccines, other healthcare organizations. They had mandates too, but they were allowing exemptions. Staff at that time started to organize, not in opposition to the vaccines, but in opposition to the mandates. We've had some rallies, news appearances, and internal town hall sessions where we have been pressing our leadership about things like natural immunity. We've had what might be considered some small victories like temporary pregnancy exemptions, but overall, our hospital leadership is dug in. Vaccinate or terminate. Any exemptions are clearly going to be as temporary as possible. It's been really toxic, and nothing was done to address the exodus of our low wage staff. We have had to board patients in our emergency room for hour after hour because there was nobody available to clean the hospital room they were supposed to be admitted to. Our laundry staff left, our kitchen staff left. Patients go without clean linens and towels. They wait and wait for food. Our cafeteria has reduced its hours or sometimes had to shut down completely. We are relocating people that usually have desk jobs to do things like clean or do laundry. We're offering to pay nurses their usual wage to come in and clean instead of giving our environmental assistant staff a living wage. So in April, we had those 600 open positions, and now here at the end of October, that number has climbed up to about 1,000, and still possibly hundreds more are on the chopping block in just a couple of weeks because of the vaccine mandate. So why should you care? Well, we are routinely going on labor and delivery diversion, critical care diversion, gen med diversion. We've had to divert ambulances, and that is all unprecedented for us. The most recent shift I worked, we were capped at about 240 some patients because of staffing. So we could take about 60 to 70 more patients than that at this time last year. If you or a loved one needs a hospital bed at Gundersen, good luck. You might have to deliver your baby in a different town. You might have to go out of state to have emergency surgery. Our hospital leadership says that canceling elective procedures so that they can fire unvaccinated staff is the right thing to do. So you might wonder if they feel so strongly about it, it must be backed by evidence, right? No. Recently, our staff out with COVID have been comparable numbers between the vaccinated and the unvaccinated. We know that fully vaccinated people get COVID and carry similar viral loads to the unvaccinated. They come to work at Gundersen, fully vaccinated and fully contagious. Just today, I had lunch with a former coworker and her husband. They had both gotten their boosters recently and then gotten COVID after. Their experience with COVID was not fun, but they're both fine, and it is reasonable to credit the vaccines for that. But it is a case in point that these vaccines do not prevent the transmission of COVID to any reasonable degree, where it should even be considered firing hospital staff or police officers or pilots or anyone else for not getting a vaccine. Nationally, there's growing visible opposition to COVID vaccine mandates, and I want to relayer that the people opposed to mandates are standing up for informed consent. They are not ignorant. They are not anti-vaccine. I'm not giving medical advice. We are not flat earthers. If you have any questions about the vaccine, I encourage you to talk to your doctor, especially if you have risk factors. End the mandates. Allow all exemptions without question.